Members of the press, good afternoon. I have had the honor of meeting with my brother, Dr. Tedros, Director General of the World Health Organization, and his team. I thank you, Dr. Tedros, for visiting us at this critical time when we are dealing with several health challenges in our continent. During our meeting, we discussed a wide range of issues pertaining to the health sector and how to strengthen cooperation between the government of the United Republic of Tanzania and the WHO. I have underscored to the Director General that his visit demonstrates WHO's commitment to a cordial relationship and partnership, which have been growing from strength to strength. Ladies and gentlemen, over the past decades, Tanzania has made significant progress in improving public health. Our focused efforts to reduce maternal mortality have delivered remarkable results, with the rate dropping from 556 to 104 deaths per 100,000 live births. Innovations and initiatives which have strengthened healthcare by investing in the construction of comprehensive emergency and obstetric care facilities, whereby close to 70% of communities can access primary health care services within 5 kilometers. In the same period, we achieved significant reduction in under 5 mortality from 67 to 43% per 1,000 live births. However, there has been a slow reduction in neonatal mortality, which contributes about 50% of overall under 5 mortality. Tanzania aligns with WHO recommendations to establish functional neonatal care units to reach 80% of the district hospitals having the neonatal care units. Last year, we took a significant step towards making healthcare accessible to every citizen by launching the Integrated and Coordinated Community Health Workers Program. This initiative will strengthen preventive health services and basic diseases management at the community levels, with nearly 137,000 community health workers set to be deployed nationwide. Through this expansion, we are improving areas to integrated preventive, promotive, and basic curative health services. Tanzania remains firmly committed to the goal of universal health coverage, a vision we are advancing with the passage of the Universal Health Insurance Act of 2023, which is being implemented. This initiative to increase domestic health financing is an important step in realizing the Abuja Declaration. Our Universal Health Services Coverage Index has already risen from 38 in 2015 to 43 in 2023, a clear indication that community-centered care is at the heart of our health strategy or healthcare strategy. Ladies and gentlemen, you may recall that in recent time, there have been rumors pertaining to Marburg virus disease outbreak in Kagera region in northwest Tanzania, over 1,450 kilometers from Dar es Salaam. I wish to inform you that following the rumors, the government took several measures, including investigation of suspected individuals in the concerned areas. Working closely with the local community authorities to enhance surveillance establishing emergency response teams on the ground, and other measures were taken. We also deployed a team of experts to Kagera region on 11th January 2025 to assess the situation and keep the public informed. Laboratory tests conducted at Kabaile Mobile Laboratory in Kagera and later confirmed in Dar es Salaam identified one patient as being infected with the Marburg virus. Fortunately, the remaining suspected patients tested negative with other illnesses. This confirmed case of Marburg virus marks the second outbreak of Marburg virus disease in our country. As you may recall, the first outbreak occurred in March 2023 in the same Kagera region, but it was in Bukoba district. And the epicenter has now shifted to the infected area, Biharamulo district in Kagera. As of today, January 20th, 2025, there have been 25 suspected cases of Marburg who have tested negative, and close follow-up has been ongoing. The cause of earlier reported deaths in the community has not been confirmed, and the efforts are ongoing to ascertain the source of infection. The government appreciates the swift attention accorded by the World Health Organization on the matter and wish to assure everyone that the measures implemented during the first outbreak of 2023, which included quick isolation, treatment of cases, contact tracing, and community engagement, proved highly effective. With the same determination and the use of these proven strategies and resources, we are confident that we will overcome this challenge once again. Ladies and gentlemen, once again, I thank the Director General for this important visit, which has availed us an opportunity to discuss and agree on important health-related matters. Following this visit, we have resolved to reassure the general public in Tanzania and the international community as a whole of our collective determination to address the global health challenges, including the Marburg virus disease, and we have also expressed determination to mobilize resources towards strengthening health systems here in Tanzania. I wish to conclude by underscoring that Tanzania is safe and open for trade and other interactions. We have demonstrated in the past our ability to contain a similar outbreak and are determined to do the same this time around. I thank you once again for taking time to visit us, Director General, and wish you a good stay in Tanzania and a safe trip to Geneva or Davos. Thank you very much. Please, it's your time.
Your Excellency, President Samia Suluhu Hassan, honorable ministers, honorable members of parliament, members of the media, dear colleagues and friends. Habari za mchana. And thank you all for coming today. First, I would like to thank Her Excellency for her hospitality in inviting me to Tanzania, and for her leadership and commitment in promoting and protecting health for her citizens. We have just held a constructive meeting covering a wide range of areas concerning her government's work to strengthen its health system and provide the services needed to advance health for all Tanzanians. And this is a follow-up of our meeting during the G20 meeting in Brazil in November. I commend the President for the investments made in emergency preparedness in recent years. I also recognized Tanzania's successful launch of Universal Health and Preparedness Review Report, which showcases the country's dedication to health system resilience. In addition, I congratulated the President on her commitment to universal health coverage through the enactment of the Universal Health Insurance Act 2023. We also discussed the government's drive to strengthen its health workforce through the launch of Community Health Workers Program in 2023, an initiative that's helping introduce more graduate health workers into the health sector. WHO is proud to have supported Tanzania's creation of new capacities for delivering health services, including in training of health workers. All this and more demonstrates your government's commitment to supporting the health of all Tanzanians, especially women and children, which is evidenced through the reduction in maternal and child mortality. And I again commend you. Her Excellency also updated me on the confirmation today of an outbreak of Marburg virus disease in the northwestern Kagera region. And I pledge WHO's continued support to bringing the outbreak under control. Since the first suspected case of Marburg were reported earlier, Tanzania has scaled up its response by enhancing case detection, setting up treatment centers, and a mobile laboratory for testing samples and deploying national response teams. As you know, Tanzania has gained strong experience in controlling Marburg, as this is the second reported outbreak of the disease in Kagera. The first outbreak, as Her Excellency said, was almost 2 years ago in March 2023, in which a total of 9 cases and 6 deaths were reported. The government's investments in response to the last outbreak has built capacities that I hope will enable Tanzania to bring this latest outbreak under control as soon as possible. To support Tanzania's response, I'm releasing $3 million from the WHO Contingency Fund for Emergencies, and this is in addition to the $50,000 that we contributed earlier to support the initial investigation. At this point, I would like to thank our partners, including the European Union, US government agencies, the United Kingdom, and numerous other national and international health partners for their strong collaboration to work to bring this current outbreak under control under the leadership of the government. Unfortunately, there are not yet any approved treatments or vaccines for Marburg, as you know, although several are in development. But outbreaks can be stopped quickly with proven public health measures to prevent infections and save lives, as Tanzania done in 2023. And considering the low global risk and the strong capabilities of the Tanzanian government, WHO advises against restrictions on trade and travel to the country. And as Her Excellency said, Tanzania is open for business. Now is a time for collaboration and commitment to protecting the health of all people in Tanzania and the region from the risks posed by this disease. WHO, working with its partners under the leadership of the government, is committed to continue to support the government to bring the outbreak under control as soon as possible and to build a healthier, safer, fairer future for all the people of Tanzania. And finally, again, thank you so much, Your Excellency, for your deep commitment to health from the day you started your office. And I assure you that you have our full support. Thank you so much. Asante sana.
Thank you so much, Your Excellency, Madam President and Dr. Tedros. And this marks the end of our session. Asante sana.
Welcome. I'm very excited today to talk about effective speaking in spontaneous situations. I thank you all for joining us, even though the title of my talk is grammatically incorrect. I thought that might scare a few of you away. But I learned teaching here at the business school, catching people's attention is hard, so something as simple as that I thought might draw a few of you here. So this is going to be a highly interactive and participative workshop today. If you don't feel comfortable participating, that's completely fine, but do know I'm going to ask you to talk to people next to you. There'll be opportunities to stand up and practice some things, because I believe the way we become effective communicators is by actually communicating. So let's get started right away. I'd like to ask you all to read this sentence, and as you read this sentence, what's most important to me is that you count the number of F's that you find in this sentence. Please count the number of F's. Keep it quiet to yourself. Give you just another couple seconds here. 3, 2, 1. Raise your hand, please, if you found 3 and only 3 F's. Excellent, great. Did anybody find 4? Okay. Anybody find only 5 F's? And anybody find 6? There's 6 F's. What 2-letter word ending in F did many of us miss? Of. We'll make sure to get this to you so you can torment your friends and family at a later date. When I first was exposed to this over 12 years ago, I only found 3, and I felt really stupid. So I like to start every workshop, every class I teach with this to pass that feeling along. No, that's not why I do this. I do this because this is a perfect analogy for what we're going to be talking about today. The vast majority of us in this room, very smart people in this room, were not as effective as we could have been in this activity. We didn't get it right. And the same is true when it comes to speaking in public, particularly when spontaneous speaking. It's little things that make a big difference in being effective. So today we're going to talk about little things in terms of your approach, your attitude, your practice that can change how you feel when you speak in public. And we're going to be talking primarily about one type of public speaking. Not the type that you plan for in advance, the type that you actually spend time thinking about, you might even create slides for. These are the keynotes, the conference presentation, the formal toasts. That's not what we're talking about today. We're talking about spontaneous speaking. When you're in a situation that you're asked to speak off the cuff and in the moment. What we're going through today is actually the result of a workshop I created here for the business school. Several years ago, a survey was taken among the students, and they said, what are things we could do to help make you more successful here? And at the top of that list was this notion of responding to cold calls. Does everybody know what a cold call is? It's where the mean professor like me looks at some students and says, what do you think? And there was a lot of panic and a lot of silence. So as a result of that, this workshop was created, and a vast majority of first-year students here at the GSB go through this workshop. So I'm going to walk you through sort of a hybrid version of what they do. The reality is that spontaneous speaking is actually more prevalent than planned speaking. Perhaps it's giving introductions. You're at a dinner and somebody says, you know so-and-so, would you mind introducing them? Maybe it's giving feedback in the moment. Your boss turns to you and says, would you tell me what you think? It could be a surprise toast. Or finally, it could be during the Q&A session. And by the way, we will leave plenty of time at the end of our day today for Q&A. I'd love to hear the questions you have about this topic or other topics related to communicating. So our agenda is simple. In order to be an effective communicator, regardless of if it's planned or spontaneous, you need to have your anxiety under control. So we'll start there. Second, what we're going to talk about is some ground rules for the interactivity we'll have today. And then finally, we're going to get into the heart of what we will be covering. And again, as I said, lots of activity, and I invite you to participate. So let's get started with anxiety management. 85% of people tell us that they're nervous when speaking in public. And I think the other 15% are lying. Okay? We could create a situation where we could make them nervous too. In fact, just this past week, a study from Chapman University asked Americans, what are the things you fear most? And among being caught in a surprise terrorist attack, having your identity stolen, was public speaking. Among the top 5 was speaking in front of others. This is a ubiquitous fear, and one that I believe we can learn to manage. And I use that word manage very carefully, because I don't think we ever want to overcome it. Anxiety actually helps us. It gives us energy, helps us focus, tells us what we're doing is important, but we want to learn to manage it. So I'd like to introduce you to a few techniques that can work, and all of these techniques are based on academic research. But before we get there, I'd love to ask you, what does it feel like when you're sitting in the audience watching a nervous speaker present? How do you feel? Just shout out a few things. How do you feel? Uncomfortable. I heard many of you going, yes, uncomfortable. It feels very awkward, doesn't it? So what do we do? Now, a couple of you probably like watching somebody suffer, okay? But most of us don't. So what do? We sit there and we nod and we smile, or we disengage. And to the nervous speaker looking out at his or her audience, seeing a bunch of people nodding or disengaged, that does not help, okay? So we need to learn to manage our anxiety, because fundamentally, your job as a communicator, regardless of if it's planned or spontaneous, is to make your audience comfortable. Because if they're comfortable, they can receive your message. And when I say comfortable, I am not referring to the fact that your message has to be sugar-coated and nice for them to hear. It can be a harsh message, but they have to be in a place where they can receive it. So it's incumbent on you as a communicator to help your audience feel comfortable. And we do that by managing our anxiety. So let me introduce you to a few techniques that I think you can use right away to help you feel more comfortable. The first has to do with when you begin to feel those anxiety symptoms. For most people, this happens in the initial minutes prior to speaking. In this situation, what happens is many of us begin to feel whatever it is that happens to you. Maybe your stomach gets a little gurgly, maybe your legs begin to shake, maybe you begin to perspire. And then we start to say to ourselves, oh my goodness, I'm nervous. Uh-oh, they're going to tell I'm nervous. This is not going to go well. And we start spiraling out of control. So research on mindful attention tells us that when we begin to feel those anxiety symptoms, we simply greet our anxiety and say, hey, this is me feeling nervous. I'm about to do something of consequence. And simply by greeting your anxiety and acknowledging it, that it's normal and natural. Heck, 85% of people tell us they have it. You actually can stem the tide of that anxiety spiraling out of control. It's not necessarily going to reduce the anxiety, but it will stop it from spinning up. So the next time you begin to feel those anxiety signs, take a deep breath and say, this is me feeling anxious. I notice a few of you taking some notes. There's a handout that will come at the end that has everything that I'm supposed to say, okay? Can't guarantee I'm going to say it, but you'll have it there. In addition to this approach, a technique that works very well, and this is a technique that I helped do some research on way back when I was in graduate school, has to do with reframing how you see the speaking situation. Most of us, when we are up presenting, planned or spontaneous, we feel that we have to do it right. And we feel like we are performing. How many of you have ever acted, done singing or dancing? I'm not going to ask for performances now. Okay, many of you have. We should note that we could do next year maybe a talent show of alums. It looks like we got the talent there. That's great. So when you perform, you know that there's a right way and a wrong way to do it. If you don't hit the right note or your right line at the right time, at the right place, you've made a mistake. It messes up the audience. It messes up the people on stage. But when you present, there is no right way. There's certainly better and worse ways, but there is no one right way. So we need to look at presenting as something other than performance. And what I'd like to suggest is what we need to see this as is a conversation. Right now, I'm having a conversation with 100+ people rather than saying I'm performing for you. But it's not enough just to say this is a conversation. I want to give you some concrete things you can do. First, start with questions. Questions by their very nature are dialogic. They're two-way. What was one of the very first things I did here for you? I had you count the number of F's and raise your hands. I asked you a question. That gets your audience involved. It makes it feel to me as the presenter as if we are in conversation. So use questions. They can be rhetorical. They can be polling. Perhaps I actually want to hear information from you. In fact, I use questions when I create an outline for my presentations. Rather than writing bullet points, I list questions that I'm going to answer. And that puts me in that conversational mode. If you were to look at my notes for today's talk, you'll see it's just a series of questions. Right now, I'm answering the question, how do we manage our anxiety? Beyond questions, another very useful technique for making us conversational is to use conversational language. Many nervous speakers distance themselves physically. If you've ever seen a nervous speaker present, he or she will say something like this, "Welcome, I am really excited to be here with you." They pull as far away from you as possible because you threaten us, speakers. You make us nervous, so we want to get away from you. We do the same thing linguistically. We use language that distances ourselves. It's not unusual to hear a nervous speaker say something like, "One must consider the ramifications," or "Today we're going to cover step 1, step 2, step 3. That's very distancing language. To be more conversational, use conversational language. Instead of "one must consider," say, "This is important to you. We all need to be concerned with." Do you hear that inclusive conversational language? Has to do with the pronouns. Instead of step 1, step 2, step 3. First, what we need to do is this. The second thing you should consider is here. Use conversational language. So being conversational can also help you manage your anxiety. The third technique I'd like to share is research that I actually started when I was an undergraduate here. I was very fortunate to study with Phil Zimbardo of the Stanford Prison Experiment fame. Many people don't know that Zim actually was instrumental in starting one of the very first shyness institutes in the world, and especially in the country. And I did some research with him that looked at how your orientation to time influences how you react. And what we learned is if you can bring yourself into the present moment, rather than being worried about the future consequences, you can actually be less nervous. Most of us, when we present, are worried about the future consequences. My students are worried they're not going to get the right grade. Some of you are worried you might not get the funding, you might not get the support, you might not get the laughs that you want. All of those are future states. So if we can bring ourselves into the present moment, we're not going to be as concerned about those future states, and therefore we'll be less nervous. There are lots of ways to become present-oriented. I know a professional speaker. He's paid $10,000 an hour to speak. It's a good gig. He gets very nervous. He's up in front of crowds of thousands. Behind the stage, what he does is 100 push-ups right before he comes out. You can't be that physically active and not be in the present moment. Now, I'm not recommending all of us go to that level of exertion because he starts out of breath and sweaty, right? But a walk around the building before you speak, that can do it. There are other ways. If you've ever watched athletes perform and get ready to do their event, they listen to music. They focus on a song or a playlist that helps get them in the moment. You can do things as simple as counting backwards from 100 by tough numbers like 17.